Hi, this is Emma Krasansky in collaboration with Dr. Christopher Steele presenting Health Equity Teachers Module, Women's Health, Reproductive Inequity. Now, the previous presentation for Women's Health discussed general aspects of women's health inequity in terms of the current health disparities and trends that are present in the United States, as well as the vulnerability factors that are major forces in creating women's health inequity socially, physically, and mentally. This presentation is now going to focus more specifically on the reproductive health disparities and inequity that exists for women in the United States. The objective of this presentation is that by the end, learners will be able to identify barriers women face in accessing effective contraception, abortion services, and fertility services. To begin, I just want to go over some general problems within reproductive health for women in the United States. The first is uncoordinated services. And so currently in the United States, women typically may see more than one provider for their health, whether it's a generalist, their primary care provider, an internist, as well as also seeing an OB-GYN, so an obstetrician or a gynecologist. And having one to two or more healthcare providers for their general health, because their reproductive health is technically included within their primary care. It can lead to providers not fully covering preventative services because they may assume that the other provider is covering them. So for example, OB-GYNs very frequently do not discuss hypertension, diabetes, other chronic illnesses that the patient may have with the patient because they may be assuming that the generalist may be covering that with them. On the other hand, generalists may not be covering reproductive health and preventative care, like HPV vaccines, pap smears, things like that with their patients because they may be assuming that the OB-GYN may be covering that. So the uncoordination of services can produce health disparities and problems for women. We also see that within the United States, women generally have limited access to contraception, screening, abortion, and prenatal care, which then is an injustice to their reproductive rights, their autonomy, as well as their health. We also see that women's sexual function is rarely discussed and poorly understood by providers. And a huge part of reproductive health is a woman's sex life, their sexual function, and their experience sexually. So if providers are not addressing this and don't even understand it fully, then we're doing a disservice to women and their reproductive health. Another major problem within the United States is unintended pregnancies. We see that approximately 1/2 of pregnancies are unintended overall, which is a very high rate. We also see that there are disparities for women of low income and women of color within the United States as subsections of women. So women overall have disparities, but then in addition to that, women who have low income or women who are of color have additional disparities within those subgroups of women. The first major theme I want to talk about is barriers to effective contraception. And these barriers can occur on several different levels. So it could occur because of the provider. The provider may lack the time to address contraception with their patients in detail. They may talk about it, but not have a little bit, make a decision on what they're going to give their patient, but they may not have the time to fully get the patient's preferences, priorities, and values in terms of what contraception methods they might be thinking they want. Providers also may have a poor understanding of the contraindications, efficacies, and side effects of different contraception methods. And this really puts women at risk for not having the contraception method that works best for them and whatever current health problems or considerations they may have. If their provider doesn't have the information, how can we expect those patients to then make good decisions about their health? Providers can also have the physical inability to perform contraception procedures. So some contraception procedures like intrauterine devices and implants do require a physical surgical component to start them and get them working within a woman's body. Providers may not have the training or the knowledge on how to perform these procedures, making their patients then ineligible for getting them or at risk for poor outcomes if they do try to perform them on these patients. Now, the barriers to effective contraception can also occur on the level of the patient. So, patients may be living in medically underserved communities with limited options for contraception methods and procedures. So there may not be many providers with their area that offer certain contraception methods, are trained in certain contraceptive methods, making those patients ineligible to receive those. Patients also may have decreased contraceptive knowledge. So how can they take part in the shared decision making that contraception should be if they don't have the knowledge to do so? They might not know what they should be asking the provider or what they should take into consideration when they go about contraception. Patients also may not have the financial means and insurance coverage for contraception. We also see that there are certain cultural and religious prohibitions within different cultures within the United States that may not allow certain contraceptive methods or contraception in general. That may be barriers to effective contraception. And we also see that there is a certain level of mistrust of the healthcare establishment within the United States from women that may affect their contraception practices and desires, as there is a history within the United States of sterilization without consent, other contraception mishaps. So as a patient, they may not trust their providers to provide them with contraception adequately. Now, systemically, there are also major problems that cause barriers to effective contraception. There is a lack of funding for contraceptive care. So the Title X funding has decreased significantly over the years, decreasing the amount of funding for contraceptive care federally. We also see that sometimes practices and policies may link contraceptive care to required health screenings like pap smears. So a patient can only get contraceptive care if they're going to get a pap smear beforehand. And that adds another step to the process. It also adds an invasiveness to the process of contraception. So again, creating barriers to getting that desired contraceptive care, jumping through hoops. Now, the Affordable Care Act, while it requires all health plans to cover basic preventative services, including FDA-approved contraceptive methods with zero cost, there are state-by-state variances of reproductive policies that can then still prevent effective contraception for women across the states. We also see that some insurance policies have limitations on the number of oral contraceptive pill packs you can get at once, meaning that patients may have to make more regular and frequent visits to the pharmacy to pick up their birth control, which can be a severe inconvenience if your patient has lacking access to transportation or time availability to go make those trips to the pharmacy. And lastly, another systemic issue that can pose a barrier to effective contraception methods is the merger of secular and religious healthcare institutions. So we see that as a somewhat common trend within the United States that religious organizations and healthcare institutions may join with other secular ones, and they may have policies because of their religious roots that prohibit contraceptive services for their patients. So these are a ton of barriers to effective contraception. You can see that it's not just simple for women to go to their providers and say, all right, I'd like to get an IUD. All right, I'd like to start birth control pills. It's not so cut and dry. So as future healthcare providers, we need to be aware of these barriers to contraception and do our best to combat and minimize them in order to create equity and get our patients the contraceptive methods that they not only need, but that they want. Take into consideration their knowledge and input for what devices they may want and help them achieve them. Another major theme I want to talk about with reproductive justice is lack of access to abortion. This is a very controversial topic within the United States that has been politicized time and time again. But just to lay it out statistically, there is a huge shortage of practitioners within the United States that provide abortions. Only 11% of US counties had an abortion provider there based on 2011 data. And we see that a minority amount of OB/GYN and residency programs provide routine abortion training. So not only is there a shortage of providers that are practicing abortions, but they're not even being fully trained in order to perform abortions for patients. This shortage, in addition to limited public funding for abortion services, lead to it being very hard for women to get the abortions that they may want or need for their personal preferences or because of their healthcare conditions. We also see, like I said, this has been highly politicized. So states will make state-by-state policies and restrictions that may create certain waiting periods for patients. So you can only get an abortion after you wait so on weeks after becoming pregnant or something like that. We also see that some states may require parental consent for minors to get abortions, that some states may bar Medicaid funding for abortion, and they also create restrictions on the provider side that make it very hard for them to perform abortion services by having additional requirements and all these hoops to go through so that they can actually provide these abortions for these patients. So with the physical shortage of providers, the limitation of funding, and all these political hoops to jump through for abortion and the controversies that exist within our current society when it comes to the right to choose, we see that lack of access to abortion is an extremely big problem for females across the states, especially at-risk populations for this include rural women who may have geographic inaccess to abortion clinics, teens who may not have full autonomy with their health care, and poor women who may not have the financial ability to then get these abortions that may not be fully covered by insurance, or they may not have insurance for abortion. Another major problem for reproductive justice in the United States is infertility inequity. So infertility is defined as the inability to conceive after 1 year of unprotected intercourse. And it's fairly common. 1 in 8 couples are infertile. However, the treatments and programs that are in place to help these couples overcome infertility and start a family and do family planning are not equally distributed and equitably accessible to all females. So we see that Black women and women of lower socioeconomic status experience disproportionate rates of infertility to begin with, and they also have lower access to assisted reproductive technologies, meaning they have lack of access to appropriate health screenings and treatment. And they also may have lower access because of financial considerations. IVF, which is a common assisted reproductive technology, is extremely expensive. One round just costing over $12,000. And with each round of IVF, you have an average success rate of 40%, which is not very high. So frequently, couples that undergo IVF have to go through several rounds. That's racking up thousands and thousands and thousands of dollars that these minority populations and people of lower socioeconomic status may not have the means to do. So not only do they have higher rates of infertility, but they're then lesser able to go around them and then still start a family. In addition, only 15 states have laws that require insurance coverage of infertility treatment. So all this is just stuff that as future healthcare providers, we need to be aware of, because it is a common problem, as well as there is a large amount of health inequity within infertility that is something that we can do things about. We can advocate, we can try to connect our patients with certain financial programs that will enable them to access assisted reproductive technologies. There's so much that we can do in the future to try to make infertility more equitable for our patients. It's a hard enough experience to go through, and it's even harder when you can't do anything about your infertility. Those are the major themes I wanted to cover in terms of reproductive justice. There's a lot more specificities you can get into in terms of women's reproductive health and the equity and inequities within it. But I hope that from this you take away the general problems, general major problems that exist within the U.S. reproductive healthcare system, as well as the major themes of lack of abortion services, infertility inequity, as well as lack of effective contraception care. Thank you.